have Dr. Tegzes here. This is my honor to introduce Dr. John Tegzes, who is the current acting dean for the College of Veterinary Medicine at Western University, just here in Pomona. And he is an accomplished academician and clinician. He received his veterinary degree from the University of Pennsylvania. He also received a master's in arts from in applied psychology from the University of Santa Monica, and a Bachelor of Science magna cum laude from and in nursing. He has a BSN. One of his passions is One Health, the combination of interprofessional organizations, and he himself represents that because he's both a veterinarian and a nurse. So he could come to Tanzania with us and work his tail off. So, but he is the dean of the veterinary school at Western, and I've had the opportunity to meet him through some other connections that have been interesting, and asked him to speak on a topic of his choice. He is widely published in the interprofessional aspect of combining different professions to provide maximal care for both humans and animals. He also has done a lot in toxicology. He did a fellowship in toxicology, I believe, at University of Davis. And of course, domestic animals and wild animals often have toxic interactions, either with things that they eat in the environment or, unfortunately, through human-related poisoning, but also occasionally with wild animals that can cause envenomation or toxin. And tonight, John is going to talk about snake bites and envenomation. For those of you who don't know, snake bites are an enormously important worldwide problem, especially in underserved and developing countries, especially in sub-Saharan Africa, where we work. And they actually are a catastrophe for a lot of individuals when there's not access to antivenin and so forth. We have a lot of snake bites and envenomations in the United States, but of course we have very, very good antivenom resources. And so most people don't die from snake bites, although occasionally they can. But tonight, Dr. Tegzes is going to discuss snake envenomation, and I am anxious to hear what he has to say. There's an excellent review article on the human aspect of this in the New England Journal from 2022, and I will put the link on the chat. But it is my distinct pleasure to introduce Dr. John Tegzes and welcome him tonight as our speaker. John, go ahead.
Good evening, everybody. It's my pleasure to be here tonight and to talk about a topic that I'm incredibly passionate about. And I'm going to open up the chat right now so that you can feel free to interact anytime you would like. And I'll try to keep a close eye on it. And we'll go from there. So as Kim just said, as Kim just said, snakebite really is a global crisis. And the WHO has recognized it as a neglected tropical disease and a neglected public health issue. More than 5 million people are bitten by snakes every year, with about half of those resulting in envenomation. Of those, upwards of 140,000 die every single year, and 3 times that amount end up with a traumatic disability, either through amputation or loss of function. And when you consider that most of the people who are affected by snake bite are among the poorest people on the planet, losing a limb is essentially like losing their livelihood, and often really does end up in dire circumstances for themselves and for their entire family. If we look at snakes around the world, they're globally oriented with the exception of the extreme north and extreme south. And when we look at snakebite in particular and envenomings, it's mostly centered in Asia. The worst statistics come from Southern Asia, but no continent is without severe snakebite problems. So again, if we look at these numbers and just translate them ever so slightly, 3 to 5 bites happen every single minute of every single day, and upwards of nearly 400 deaths every single day. And what makes this really horrifying is that many of these are treatable and preventable. Many of the deaths are preventable. When we start to look at what snakebite looks like, you'll see various, and I'm going to show you lots of images tonight, and I'm going to ask you some questions and ask you to think about what might be going on. But we start to see different levels of trauma that occur. And in this photograph, again, really emphasizing how when death doesn't happen, often it can result in traumatic amputation. And that really, for people who are among the poorest of the agricultural workers in particular, you're taking away their livelihood, and that can be devastating for their entire family and their community. So snakebite data in animals, really, it's not reportable, so we don't have the same types of reliable statistics year after year, but some resources estimate that 150,000 animals are envenomated every year in the United States, are bitten. That many are bitten, but upwards of nearly 50,000 are envenomated. But it's really difficult to know, because the reality is that most of these never report for veterinary care, and they probably die either in the field or they recover, and we just don't know about it. And of all the animal species in the United States that are mostly envenomated, it's cattle and horses. And again, when you think about the environment where snakes live and the environments where those animals would be, you can see why that connection might happen. I'm showing you again images because I want you to understand a little bit the differences between humans and animals, and where they're bitten and what their clinical effects might look like. So just start to take it in a little bit as you start seeing some of these images, and I'll explain a lot as we move along. So versus other serious health conditions, snakebite should be a treatable condition. However, we still have significant morbidity and mortality simply because the treatments aren't widely available, accessible, or affordable. The WHO estimated a couple of years ago that the average snakebite victim worldwide can only afford up to $6 for the complete treatment, including everything that they would need. So when we start to boil it down to those types of figures, we start to realize that the treatments aren't going to the people who need it the most, number one. And number two, there's a lot of politics around antivenom availability, how it's manufactured, where it's stored, and who gets to benefit from treatment when it's needed. To complicate it, there are hundreds of snake species around the world, and each of these, the way that antivenom is currently developed, we need a different antivenom for every single snake species. So it's not like keep a bottle of antivenom on a shelf and treat any snake bite that walks in the door. So again, just to kind of summarize, it's the treatments that we currently use for snakebite were developed in the 19th century. They really haven't been updated very much since then. Very few countries in the world have the capacity to produce high quality antivenom in the concentrations that are needed every year, and that we're often facing weak or inadequate healthcare systems in remote communities where even if the treatment is available, it doesn't always get to the people who need it most. So the focus of this presentation, I want to talk a little bit, that was a broad overview of the global challenge around snakebite. I want to talk about the current approaches to treatment, the research that I've conducted through an organization called Snake Farm, and then what I think the future of snake antivenom work looks like and where we need to start focusing our energy and our efforts. So snakes, and again, they're starting very broadly, and I'll go quickly through some of these slides, but I just want to really emphasize that snakes are remarkable creatures, that our ecosystems depend on them. They're healthy for the environment. They are necessary creatures, and they're very poorly understood, and I think poorly respected by the average person. They are on every single continent except for Antarctica, and which is interesting, and that was one of the comments in the chat already. Yeah, so far as I know, there are no snakes in Antarctica at all, and some of the island communities don't have snakes as well. On this diagram, I would just want to emphasize that they come from common stem reptiles. So all of the reptiles, including some of the dinosaurs, come from these common ancestors, that they evolved over millions of years ago. And that's important when we get to some of the adaptation of venom itself and the evolution of venom. It's interesting that they're not as diverse as you would think they would be in terms of the animal kingdom. There's a lot of similarities between them, which, begs the question, why has treatment been so difficult? Why do we need very different treatment for each type of snake envenomation? So again, looking at these, what I want to emphasize here is that they're split about 50-50 between the venomous and non-venomous snakes. And there is evolutionary evidence that even the non-venomous snakes today probably had some capability to inject venom at some point in their evolution. So polling question, just raise your hand if you feel like it, and you don't need to. We're not doing a formal poll, but are you afraid of snakes? Anybody in the room happy to admit that they're afraid of them? Yeah, it's interesting. I think that's also kind of an adaptation to our environment. We tend to fear snakes. When we look at all the things, what are the things that people are most afraid of? Almost always snakes come out on top. And it is very common. And people will say they have a visceral reaction when they see a snake or even think of a snake sometimes. And I personally think that was an adaptation for us to fear them, to avoid them. Because when we encounter a snake and we get bitten, it often ends very poorly if we don't get treatment right away. It doesn't benefit the snake whatsoever to waste its venom on you. And so from the snake's perspective, they don't want to be around you either. And so I think it's kind of the symbiotic relationship where we've tended to stay in our own lanes and stay away from each other. And we've been able to do that very well over many, many millennia. However, as we all know, the earth is feeling smaller every day. The human population is growing. We're living in places where we haven't lived before. And so our environments are merging together. And that's why I think this is a bigger issue today than it's been historically. So some of the work that we do at Snake Farm is educating people about snakes so that they fear them less. We want them to respect them, but we don't want them to necessarily fear them, because the danger with that is that we'll just try to eradicate them. And that's really poor for the environment. Again, in One Health is the interaction of humans, animals, and the environment. And that part of it is really important, that we respect their role in our ecology and in ecosystems, and that we dispel some of the fear. Now, that's not to say they should be catching snakes, but that we want them to be a little less fearful around them. So this is some of the work that I've been engaged in South Africa, where we start to work with children. So instead of them growing up thinking all snakes need to be killed, that they learn some healthy respect for them. So let's go talk about venom. If we need to talk about how we're going to change the future of snakebite, we need to understand a little bit about venom and how the treatments have developed up until now. So by definition, it's a substance produced in a secretory gland, and that it can contain one or more toxic substances, and they're always delivered either through stinging or biting. And when we start to look at the animals that do that, we think about all those creatures that, again, elicit fear within us. And for spiders in particular, every single spider on the planet is venomous, but for many, their fangs are not long enough to penetrate mammalian skin. And so we often don't think about them as being dangerous. So if we were to analyze the venom of some of the most innocuous spiders on the planet, you would see that they're actually quite deadly, but they just don't have a mechanism to deliver that to a mammal, so they tend to be safe. When we look at, I love this photograph, because whenever I talk to students about venom, and when we think about how it's delivered, those fangs are literally hypodermic needles. They're hollowed out fangs. They can extend, they inject, and then they release. And they're essentially giving an injection into the subcutaneous tissue. And for rattlesnake venom, at least, and that's the statistics that are on the slide right now, there are over 90% of the components are made of proteins, but there are over 50 active compounds just in rattlesnake venom. When some of the other snakes have over 100 biologically active compounds. So think about that for just 1 second before I advance the slide. Why would venom be so complex? Why does it need to have that many substances? And so the real question is, what is its purpose? What is it actually doing? So think to yourself a little bit about what you think it's actually doing. And when we move along, oops, my slide is not progressing. Let's move it that way. When we think of venom's purpose, we need to start just looking at some images that will help to give this. These are taken from textbooks, and the resolution is pretty bad, but you can see this is a pediatric hand with quite a bit of swelling and a little bit of puncture wounds, and you can see the extension to the swelling. On the next slide, you can see the ecchymoses, the blebs, the oozing. There's blood coagulating and anticoagulating at the same exact time, which seems so counterintuitive. There are bioactive proteins that will increase blood pressure, and there are bioactive compounds that will decrease blood pressure, doing the exact opposite. So why on earth would something be that complex and almost sound like it's contradictory? When we, and to answer this question, we have to look at this picture. So here's your typical rodent, who is the typical food for a snake. And when we think of a snake and look at what that looks like, boy, my slides aren't progressing here. It is camouflage. This is a Southern Pacific rattlesnake, and it camouflages perfectly into its environment. And what do you know the differences between those two animals? One is very quick, one is very slow, one is very stealth, the other tries to be stealth, but it's moving and active all the time. And when you put these two together, and you consider that this snake on your left requires this in its diet, number one. Number two, it can't chase it down like a cheetah, so it's not going to hunt by chasing down. It needs to wait for its prey to come to it. And then on top of that, when the snake eats its prey, it swallows it whole. So it's not going to chew it, it's not going to masticate it, it's not going to have all the digestive enzymes acting on it all at once in the mouth and all the way down. It's got to eat that whole thing, fur and all, bones and all, and it's going to swallow it whole. And so what do you suppose the things that venom are trying to do? Well, it's going to try to slow down its prey. So it's immobilization. So some of those compounds are merely to immobilize it. Doesn't want to kill it, but it wants it to be immobilized. So there are a lot of myotoxins and neurotoxins. And then perhaps even more importantly, it needs to digest it. And so snakes start digesting their prey before they even eat it by injecting enzymes that will start to break down tissues immediately. So, and those contain cytotoxins, hemotoxins, cardiotoxins, and again, there are neurotoxins. There are lots of different things. A lot of my slides refer mostly to rattlesnake venom. So if we look at some of the compounds that are found within rattlesnake venom, you'll see all sorts of things that are enzyme mediated and toxin mediated. And also on the left-hand side, you see that there are things that result in immediate effects, slower onset effects, and long-term effects. And it's incredibly complex. And all of this is happening all at the same time. So when we start to look at those clinical images, you can start to make sense about some of the changes that you can see. So if you were designing the perfect antivenom, what would you target? And I'm going to go back one slide again. If you just think about this for a moment, what is it that you would want it to be able to do? You kind of need it to do all of these things if you're going to leave the animal or the human without any untoward effects. But that's really complex, isn't it? So what have we done historically? So what we've done with traditional antivenom in the history of antivenom, and the very first one was developed in the 1890s, and they would use an animal vector, so to speak, to deliver immunoglobulins to the person or the animal that had just gotten envenomated. So typically they would use a horse. Today it's more likely to be sheep, and they would inject them with small amounts of venom repeatedly over time and allow the animal to create antibodies and allow the animal's immune system to start to develop some counteractive measures to that. They would pool the plasma from that animal, and then they would create the antivenom from that. Now, when you think about it, all of these started in the 1890s, and they started with the horse. why do you suppose they started with horses? And to answer that, it's not a scientific question by any means. It's because those were the automobiles of the time. There were horses everywhere. They were in every major city around the world, and they were in the countryside. So that there were horses everywhere you could look. The second thing is they're really big animals. So you inject a little bit of venom. Remember that venom is designed to immobilize and digest mice. So a horse that's nearly 2,000 pounds, the effect of that venom probably isn't going to be severe, especially if you're giving small amounts. So it's relatively safe for the animal, and it will develop an immune response to that venom. So again, the very first antivenom was developed against the venom of the cobra, and it was developed in horses. And then in the United States, it was the 1920s when they started creating, using the exact same method to create antivenom for rattlesnakes, copperheads, and water moccasins. If we look at some of the old literature and look at what it looked like, other than the medical equipment looking different, it's how we do it today isn't dramatically different. So what are some of the problems with that type of approach? Well, first and foremost, over 70% of the antibodies that horse will create will do nothing at all to the venom. They won't neutralize it. So we're getting lots and lots of other immunoglobulins against all sorts of things that the horse was exposed to that have absolutely nothing to do with the snake or the snakebite. So we also know when we administer immunoglobulins to people, especially if it comes from an animal, that immune-mediated disease can be very easily initiated. And the same is true in dogs. If we give them antivenom that's derived from horses, that immune-mediated disease, while it's not as common as it is in people, it will occur. And also that antivenom works by preventing damage. So once any type of tissue level damage has occurred, you're probably not going to be able to reverse that with the administration of antivenom. The best you're going to do is to prevent its progression. And so if people and animals don't present to the emergency department in time, if a long time has gone by, they're still going to have a lengthy recovery because of the damage that's already been done. In response to how difficult it is to make and administer and use antivenom, there have been all sorts of snakebite kits. And I encourage you all to go onto Amazon later tonight and just search for snakebite kits. You'll find all sorts of things. I found these contraptions that you can hook up to your car battery that will electrocute the wound, and all sorts of things that sound like voodoo today. And when I talk to students about the snakebite, I always say, like, these kits that are meant to lance the wound and suck out the venom. Imagine if you gave a subcutaneous injection to a human or an animal and you decided, oops, I didn't want to give that after all, I'm going to take it back out. Could you get that back out of that person? I don't think so. So all of these things aren't going to be very readily, they're not going to work very, and an old tourniquet here, we know today that's absolutely a no-no. We're not going to do that unless it's a life or death situation for other reasons. So traditional antivenom and contemporary antivenom look very similar. They're these lyophilized immune-mediated substances. In animals, we still tend to use a lot of whole IgG types of antivenoms. In people, we use Fab and Fab fragment products to reduce the immunogenicity, but there are issues related to even giving them in those ways. So again, reminding you of all of these effects and asking you again, do you think giving IgG that's horse-derived is going to counteract all of these things? And by now, you know the answer is no. So let's look in a little bit deeper on what venom is doing and what some of these substances are doing, so we can think about what would be the future of antivenom, what it would be the next best thing for us to do. And to start to answer that, we need to think about the extracellular matrix. We need to think about collagen, where it exists and how it exists, because remember, from the snake's perspective, it's trying to break things down. Collagen, even for mammals, is very, very difficult to digest. And so a lot of that enzymatic activity that's being injected from venom is trying to break down collagen. And it's doing that to digest it, but it's also allowing the venom to spread to various tissues and just to move away from the bite injection. A lot of these snake A lot of these proteins that are found in snake venom actually travel through the lymphatic system rather than through the circulatory system once they go to a limb. And so it's important to understand how that venom is going to travel through the body and do the work that it needs to do for the snake's perspective. So for collagen, one of the things that can degrade that are metalloproteinases. And lo and behold, we do see a lot of metalloproteinases in snake venom. Phospholipase A2 is also really highly prevalent, and those are probably the two most common proteins that are in highest abundance that we see in a lot of different venomous snake venoms. When we start to compare just those two proteins, we see some of the things that they do. They're pro-inflammatory, they cause necrosis of tissue, they can cause breakage or breakdown of tissues and proteins, and we start to see that that's probably what's happening for the digestive part from the snake's perspective. We also know that there are metalloproteinase inhibitors that can be effective and are found in horse plasma after we inject them with snake venom. And what's interesting, though, is that they really do require a metal binding site. So metalloproteinase, that these are enzymes that require a metal such as zinc to become active, and that from horse serum in particular, it needs the whole IgG molecule for that metalloproteinase inhibitor to be functional if you inject it into another animal. And so when we start to use Fab fragment and FC fragment antivenoms, you can see that the metalloproteinase inhibitors are probably going away. You're not going to get the benefit of those. So fun fact just about snake venom, I think it's one of the most remarkable things on the planet and has been poorly studied up until now, but the drug captopril is derived from a pit viper venom component, which we all know is an ACE inhibitor. So there's some really good things that can come about from studying venom. When we start to look at phospholipase A2 inhibitors, we also notice that IgG can bind to phospholipases, and that when it does, though, it's also strongly associated with anaphylactic reactions in people. And so that's one of the dangers that we see by injecting whole IgG from an animal source into a human being, that we can often develop worse disease than we see from the snake bite itself. And that's one of the reasons why in the toxicology world, we always want to make sure that a human or an animal was truly envenomated before we even think about giving antivenom, because sometimes the treatment can be harsher than the bite itself. When we look at IgG molecules, and as you know, the full molecule contains the Fab portion and the FC portion, and we break that down into the Fab2 molecule, and we can further break that down into the Fab molecules themselves, but we lose some important binding sites every time we do that. In addition to that, though, we also decrease tissue penetration, and it changes the half-life for circulating antivenom. So when ProFab came along, it was meant to be this really miraculous drug that was going to decrease the immunogenicity of IgG-based antivenoms, and it also was going to decrease the amount of antivenom that we had to administer to a human who had been envenomated. But it comes with all sorts of issues itself, with needing repeated dosing, perhaps more rapidly than you would suspect. And then mostly importantly that I want to point out is that for distal limb envenomations, you get really poor tissue penetration with the Fab and Fab fragment products versus the IgG products. And so understanding that changes even tissue penetration, and just and a few more images just to bring home the point that somebody recovering can still have debilitating wounds that require long-term care, skin grafting, and multiple surgeries to salvage the limb. So what do we do, especially when we consider that there are so many different snakes around the world, and how can we improve the efficacy? How can we ensure safety? And how can we improve availability and produce antivenom in high concentrations, deliver it to those locations where we need it the most, and do it at a minimal cost? So these are all the things that brought my research into fruition, of asking these really difficult questions. What can we do to improve this? And what if we looked for innate immunity as opposed to adaptive immunity? So whenever we inject a horse or a sheep with a venom product, we're relying on that animal's immune system to develop an adaptation or adaptive immunity to the venom. So what if we went toward innate immunity instead and started to look at pathways where we could deliver innate immunity? So to answer that question, and what my research group did is we asked this question and we looked to the literature and we thought to ourselves, what animals seem to be resistant to the effect of venom? And if you can think of any, go ahead and throw them in the chat. You may be aware of some already, and I'll highlight some of those to you now too. But this was a video from many years ago. I'm not going to show it to you now, but it was about honey badgers. And if you ever saw this video in the past, it was this, they show a honey badger killing a cobra. And in the course of killing that cobra, it gets envenomated and it falls asleep for a second or two, but then gets up. And so you start to ask your question, what is it about badgers that allows them to get envenomated while they're hunting? And what can we take from them that we could potentially form into a drug? So if we look at other animals around in the animal kingdom, we know mongooses are often, will also predate on snakes. Prairie dogs are also fairly immune to them, but snakes themselves are also immune to snake venom. And so when we think about that for a second and think, okay, so what is it about them? And remember that phylogenetic tree that I showed in the beginning, they come from common ancestors. So even those with venom that and those without have evolved with similar innate abilities. And if we start to look at the literature, we start to see some papers starting with king snakes. And the king snakes are a non-venomous snake that are very, very common throughout the state of California, but they're found in highest concentration wherever venomous snakes are. And they're called king snakes because even though they're not venomous themselves, they tend to hunt and kill all the venomous snakes in the area where they live. And there are lots and lots of species and subspecies of king snakes. So when we first started going down this pathway, we thought, well, there's probably immunity that's very regional with each of these different species and subspecies of king snakes. And in fact, if we go all the way back into the 1990s, there were papers already looking at the venom neutralizing properties of king snakes. And even back to 1969, people were looking at rattlesnake plasma offering defense in mice envenomated by other species of rattlesnakes. So Snake Farm came along, and this was an organization, a research organization that I had the privilege and honor to work with for many years now, for more than 10 years. It's probably 15 years by now. And when we were founded by a biologist who simply asked the question, why is snake antivenom so difficult to produce, and why can't we get it to the people who need it most? And we started having conversations and looking through the literature, and we started to look at king snakes in particular and looking at their plasma. This is our research team, and again, we've worked together for about 15 years now, and we've in facilities here in California, but also in Peru and in South Africa. And what we ended up doing, and I'm going a little bit fast, I can go into a lot of detail about our history and how we came upon this, because it took a lot of years of work and thought in how we're going to do this work. But we developed a snake donor colony. We had over 200 snakes, and most of them are king snakes, but we also had boa constrictors, ball pythons, and carpet pythons. And what we did is these are animals that have innate immunity. We would bleed them once a month, and we would pasteurize their plasma and do a few other things to make it injectable into mammals, and set up a clinical trial to test both its efficacy and safety in dogs. And over a 2-year period, we treated 46 dogs from 2 veterinary specialty clinics in San Diego, and all of them had moderate systemic signs of envenomation. We used a modified canine snakebite severity scale to objectively measure the degree of envenomation, and then we treated them And at the same time, we had a cohort of about 100 dogs that received traditional IgG-based antivenom, and we compared results. And so I want to show you some pictures. You're probably not used to seeing dogs that have been envenomated, but on the human side, a lot of bites are on the distal extremities, either hands or feet. So you get a lot of people who feel like, they watch Nat Geo and they think, oh, I can wrangle a snake. And they have a little bit of tequila in them and they get a little bit daring and they reach down to pick up a snake and they get bitten on the hands. The alternative is innocent people walking by, children walking by and getting envenomated on their legs or feet. Well, dogs are curious by nature. Snakes don't have an odor that necessarily is offensive to them. They hear a rattle from a rattlesnake and it might actually entice the dog toward the snake as opposed to away. So this was a little dachshund that got envenomated on his tongue because he walked up to a rattlesnake panting, all excited, and got bitten. And this is the pre-treatment wound on the tongue, and 24 hours later, after administration of the antivenom, the wound was virtually gone. It disappeared so quickly, much more quickly than you would expect. This was a golden retriever that was envenomated on a distal hind limb. We often in the veterinary world will look for evidence of echinocytosis or changes in red blood cell morphology in order to just do a quick blood smear at the time of presentation to see if envenomation has indeed occurred. But what I love about this picture is the picture on the left is a very happy golden retriever who had just been envenomated by a rattlesnake, but you'd never know it because he was just so happy, and he looks just as happy after treatment. So his affect didn't change one bit. He was happy coming in, he was happy leaving, but he definitely had severe signs of envenomation, even though he looked so happy in the left photo as well. So what we noticed in our clinical trial is that we had rapid reversal of clinical signs with decrease in the canine snakebite severity scale. We sometimes would see resurgence or worsening of the severity scale at 24 hours post-envenomation. That's very common in people as well. And that's because we know the antivenom doesn't work. It doesn't last, the effects don't last forever. And sometimes there's greater tissue penetration or traveling of the antivenom. And so we'll sometimes see worsening condition post 24 hours post. We saw the same thing with this one. So it's not a panacea that everything goes away immediately, but it definitely was no worse, if not a little bit better than traditional antivenom. And so just some data slides, and most of these across the board, it was male, female. There were no real breed predispositions. Most of these happened in the spring with some in the summer and fall, but spring tends to be the worst time for dogs in snakebite. Afternoons between noon and 6 p.m. is the most common time, and that's when people are out usually hiking or doing activities with their dogs, and that most of the locations were on the muzzle. So remember that dogs are going to go right up to that snake and smell it, and that's when they're going to get bitten. Occasionally we'll see them in other places. We saw that one that was directly on the tongue, but that was a dog literally, if he hadn't gotten bitten on his tongue, it would have been on his muzzle for sure. And we see the decrease in the snakebite severity scores over time with resolution in nearly all of them. We had one death in the study, and that was the owner elected for euthanasia. The dog probably would have survived, but for whatever reason, the people weren't willing to go. But in the same cohort, same time period, I think there were 3 or 4 that were euthanized because of treatment failure with traditional antivenom. So we did just as good, if not better. They do get other treatments, and so just to show they get some other things, every single dog gets an analgesic. Snakebite's painful. It's painful in people, it's painful in animals, and the antivenom isn't quick enough usually to resolve the pain. And so what this work that took a couple of years, we were able to show that it was safe, that it was efficacious, and that data were strong enough that we received a patent for the product from the trademark office, and we've also received USDA licensing to use it therapeutically in dogs in the state of California. So we have those go-tos, but there's been so much work, and I'm giving you just the really Reader's Digest version of how we went from a concept and idea to a product that we can actually use commercially. And really, though, the eye to this work was to create treatment centers globally where people need this antivenom the most. So this was a prototype of what our dream would be, is that we would create these little snakebite treatment centers that would house enough snakes to donate plasma, that people could create antivenom at the point of care when it's required. I kind of mentioned we would bleed our snakes once a month. We would make several hundred vials of antivenom from our collections. Our average cost for us to make our antivenom was about $50 a vial, which is significantly cheaper than what housing a horse, injecting a horse, and all the work that's involved in collecting venom. Our work doesn't require any touching with any venomous snake whatsoever. We don't need to collect venom in order to do the work. We use really snakes that are very easy to handle, that are very docile and aren't harmful in any way. So our vision is that we want to prove that this would work in people, and we've made some significant strides to go into clinical trials in people, and I'll talk about that in just one second. In addition, though, we have in vitro evidence. We've done some work in the lab. We haven't done it in animals yet, but we've done enough work to suggest that this same exact product that we use in dogs for rattlesnake envenomation is equally as effective with cobra venom or with black mamba venom. We use black mamba, green mamba, asp, and cobra in the lab. We use venom from each of those and looked at in vitro ways of measuring venom neutralization. And we don't really see a big difference between rattlesnake and other types of venom. And so if this proves to be true, this potentially could become a universal antivenom. At the same time, we've been toying around and playing around with ways to make emergency pens that people could carry with them when they're hiking or other places. It wouldn't be the same as a traditional dose of antivenom, but it might be enough to counteract some of the effects before they get severe so that they can get to a hospital for treatment. And so we were doing some complicated things where we were injecting our donor snakes with very small doses of venom to increase their innate immunity or to mount also some adaptive immunity to it and concentrate it a little bit more. So Snake Farm, as I mentioned, is the name of the organization. We had research space in San Diego, Los Angeles, and then South Africa and Peru. And these are just some photos of our work in South Africa. And one of the things that we do, again, we're very much into conservation of venomous snake species. This is a green mamba that had been donated to us that was found to be ill, and we were trying to get back to health. And what we're trying to do, it's not that we're trying to rescue animals that need to be euthanized or that are going to die, but we're trying to do it as a public education tool too, to say we value these animals, they have a place in the environment, and that they are important, and that we need to learn to respect them, but also to learn how to live with them and to be aware of where they are. We had lots of opportunity to collect and see venomous snakes in their native environment, to collect venom samples so that we could use it in the lab for testing, and also just to create this space. This is the research group in Peru where we did a tremendous amount of work in the Amazon in the early years and looking at different types of venom there. And it's a Bushmaster in the 4 field, and looking at how we can address some of the issues in different continents. Our work, again, it's all about taking snakes and their blood and you doing it in a very humane manner that doesn't harm the animals, that doesn't harm us in the process. Collecting blood from snakes is relatively easy. We use a Doppler, we use heart sticks, they clot just fine. The snakes tolerate it incredibly well, and they can undergo cardio punctures multiple times with no adverse effects. None of our snakes ever lost weight. They never seemed to change their affect at all. And we would collect about 8% of their blood volume every month, and they did just fine. There's a little video there that I'm not going to show at the moment. Oh, I'm going to go back again. I just want to go to see if there are any questions, and I can show you the video that talks a little bit about some of our work in South Africa if there's interest in that. But I'll just open it up to questions right now. What do you think? What are your thoughts?
Well, absolutely fascinating, John. I don't want to hog all the questions here, but I have a few. And if people want to put some in the chat or just raise your hand, or use your hand raiser thing on the speaker thing. So when you, and maybe you talked about this a little bit, but do you have an idea of what the antibody characteristics are of king snakes and carpet pythons and stuff? What it is about, I would anticipate it's a pretty complex molecule.
It
And
is.
I don't want to violate any patent things. If
Yeah,
you know
no, there's none whatsoever. None whatsoever. And I talk very freely about this. Snakes don't express IgG, it's IgY, and it's structurally slightly different, although it looks very similar to IgG. And we would measure IgY antibody titers on all of our donors. We had numbers on their cages. We knew exactly what their titer was from month to month because it seemed to be a marker for us. So when we would test the efficacy of our antivenom, we always knew the IgY concentration or the titer within each vial, and we tried to correlate that a little bit with efficacy. And in fact, when we went to the USDA for licensing, it was the one thing that they held on to. They said you have to have some marker to say what your efficacy is or what the predicted efficacy of each batch of antivenom actually is. And we kept saying, it's just a marker. I honestly don't believe in the core of my being that IgY is what's doing the work. I think there are anti-metalloproteinases and anti-phospholipases and other proteins that are probably doing more work than the IgY. Having said that, it's a combination of all of the above. Because it's structurally different than IgG, even though it looks similar, we didn't see the amount of immune-mediated disease. Now, mind you, we've only ever injected it into dogs. We've never injected it into any other species. So I don't know what it would happen in people or other species, but for sure in dogs, there was no evidence of any immunogenicity or immune reactions elicited from it. And we suspect that it might be less immunogenic than IgG because it's so foreign. It's a reptilian IgY antibody that we think that might be associated with it. Now, I mentioned a second ago that we would measure the IgY titers on each vial of antivenom we would produce, and our data never, like the statistics didn't ever suggest that if we had a really high titer that the dogs did better, or if they had a low titer they did worse. In fact, sometimes we found that the dogs responded better if the IgY titer was lower than higher. So even though the USDA was requiring us to measure and report and suggest a predictive efficacy based on IgY titers, it probably had nothing to do with it. It was just something we could easily measure in the lab. And so that's what we did.
It's fascinating. I mean, it's remarkable that you were able with the same, let's say, king snakes, or let's say it's a ball python, maybe in some of the other countries, using those snakes, and it was equally efficacious, or could be equally efficacious for both crotalids, pit vipers, and or elapids, cobras. I mean, because they're completely different kinds of venom. So it's just, that's an amazing discovery.
It really is. It really, really, really is. And when people have mapped the DNA of snakes, they found in the oh my gosh, in anacondas, I believe it is. It's one of the giant python constrictor breeds. They found the codon for cobra venom in those snakes. So what cobras express for their venom, they found the exact same DNA sequences in these non-venomous species that don't even have venom glands to create venom, yet they have the DNA sequences to make that venom. And so there's some common linkage going back, and that's where maybe there is that innate immunity there that we just don't really understand where it's coming from, but it's there somewhere. And again, these are snakes that are from different continents offering benefit to venomous snakes on another continent. So it is pretty, there's more mystery than there is understanding of why that's happening and where it's coming from.
And I mean, this is such an wonderful example of really thinking outside the box and carrying it to a different level, where a relatively simple procedure, extracting blood from a snake that doesn't have problems with envenomation, and then setting up, I love the little mobile clinics and everything. I mean, that's how you change things in developing countries, is really thinking outside the box, but using very simple, robust not complicated contraptions to do it. And then, has there been any expression? I was gonna say, have there been any bites on doing it in humans? But
Yeah.
it really seems like a very, very worthwhile project.
Yeah, we got the go ahead in South Africa to go ahead. So I spent the latter part of 2019 in South Africa and came home right before like mid-December. And as we know, that was just when COVID came on the scene. And we had gotten the go ahead with a university. They were hinting that they would give us permission to go into human trials. We were going to do some lab stuff there, though, and do some dog work there as well before we even thought about it. And then the pandemic happened, the country shut down, and things really just, we haven't been able to reinvigorate that work there yet. But that was the plan. The South African government, they gave us 3 acres of land to create that snake farm enterprise. That was government land that they donated to us and said, go at it and develop what you can. And midway through the pandemic, they took the land away from us. And it's just, politics as it is, and the world was in a crisis state. So I don't know what they did with that, with the land there. None of us were there at the time. So and travel was very difficult. But at some point, we hope to go back and open those discussions again and see what work we can do, even with dogs, with a different dogs on a different continent with a different venomous snake, but the same treatment, and see what happens. And I think that's the most initial place.
Would there be any role for this as a like? I know that there is a vaccine for rattlesnakes for curricular bites, but I mean, for this technique, would there be any role for a prophylaxis, some sort of a protective kind of vaccination?
It's a great question, and I don't know. The rattlesnake vaccine in dogs is controversial because the data, at least that are published, suggests that it doesn't really offer any benefit, in the sense that the morbidity and mortality are the same in dogs that have been vaccinated and unvaccinated. My personal experience with the dog rattlesnake vaccine is that those dogs can take their time to get to the clinic, and they still do well. So I think it does offer some benefit. They still require treatment. They still require sometimes intensive care, but they do tend, it's been my experience, like, you don't have to run to the clinic in 10 minutes. You can wait 2 hours and you're going to have the same effect. So I think it does offer some benefit, but yeah, there's still a lot of unknowns when it comes to how best to treat these and prevent it.
One of our viewers asked that they take their dog backpacking and camping trips where there's rattlesnakes, and what should we have in our dog's first aid kit in the event that she's bitten?
Yeah, so the rule of thumb, and I talk about this all the time with veterinary students and the general public. You do want to get to a veterinary clinic as soon as possible. The most important thing is to keep the dog really calm and to walk out calmly. So that's the hardest part. You can do like a medium compression on the wound itself if it's on a limb. You don't want it too tight, you don't want it too loose. But just some kind of gauze bandage over the wound site itself, if that's possible, and carry the dog out. So limit movement, because again, a lot of venom moves through the lymphatic system, not through the circulatory system, which, as if they're bitten on a limb and they're using that limb, it's going to disperse. The venom will disperse more rapidly. So if you can carry them out, that's better. Immobilize the limb, carry them out. If you can't, you walk out very calmly. It's counterintuitive because you want to run and get to your car as soon as possible. But I'd actually suggest the opposite. Take your time and walk out very calmly. And even though it'll take longer to get to the vet clinic, you probably it's better for the dog that you're not doing more dispersal and getting their heart rate up and doing things that would cause the venom to spread.
Is there any benefit? It sounds kind of cruel if you ask me, but I've heard people that have done aversion therapy where they have a snake that's taped up and.
Yeah, aversion therapy works well in dogs, and again, you have to find the right person to do it. We used to do them every year on our campus for veterinary students, and there was an organization that had devenomated rattlesnakes so that they weren't able to inject venom. Again, I want to kind of avoid the humane issues, whether that's good for the snake, bad for the snake. It's probably bad for the snake in all reality. But what you're trying to do is get the dogs to have an aversion to the scent of a rat, the scent and the sound of a rattlesnake and even the sight of it. So if they just even bring rattlesnakes with the rattle and with and they're in a cage where the dog can see it and smell it, and what they'll do some aversive thing to the dog, and it could be citronella in their face. It doesn't have to be a electrical shock or anything horrible to the dog, but just something that the dog finds offensive. Every time it shows attention toward the snake, there is evidence in the literature that that really works, but it wears off. And so they say that you have to do it every year, and that the training should be done just before the peak of rattlesnake season. So depending where you live, that could be spring, it could be fall, but they do suggest that you do the training every year. And it's harder and harder to find people. We used to bring a trainer to campus every year, and then our university decided that we couldn't bring venomous snakes to campus anymore. What do you think about that? Like, of course, we probably should have never brought venomous snakes to campus, but it was, it felt like it was safe when we were doing it, to be honest with you. But I understand the university doesn't want that liability anymore. But you can find people in the community that do that work.
But one of the things that is fascinating, when I was at UCLA in my fellowship, we were interested in some of the potential antibiotic aspect of snake venom. And you had the slide that you had all the molecules, and L-amino acid oxidase was, of course, on there. And the thing I learned is that snakes in general, reptiles in general, but especially snakes, are very sensitive to bacteria, especially gram-negative bacteria, so Pseudomonas and things like that. And when they eat their prey whole, they're exposed to a pretty high load of fecal microbiota, and that there may be some role when they envenomate that sort of sterilizes their prey. Is that anything that you've heard about? Or
yeah, it's absolutely true. It's absolutely correct. We know that venom itself is antibacterial, antifungal, and antiviral, and it has some pretty strong components to it. Because remember too, that the amount of time that it takes a rodent to course through the GI tract of a snake is long. It can take a couple of days. And so the amount of putrefaction that happens within their GI tract even would overwhelm the animal if there wasn't something that would break down those bacteria. So that's absolutely correct. And I think that's again, in an area of antimicrobial resistance and all the challenges we have on the planet today, I think it's worth investigating and seeing if there's some molecule we can isolate that might offer protection and be formed into pharmaceutical form at some point.
yeah, especially crotalids have been particularly wonderful for developing medications. All of the thrombolytic therapy that we used, or the early thrombolytics that we used in coronary occlusion and stuff, came from the knowledge of the sort of hemolysis that happens with crotallid envenomation. And then I think some of the heat sensing stuff, because they have that heat sensing capability as well, that some of that technology was sort of, the idea of it came from watching snakes and what they do.
Mm-hmm. Mm-hmm. Yes.
Other questions for Dr. Tegzes?
Yes, please.
Yeah, you showed pictures of several creatures that are immune to the venom of snakes. Is any work being done on those animals, for instance, to determine why they are immune, and can that study be used to create an antivenom?
Yeah, well, that's such a great question, and it's a question we ask ourselves. And the simple answer to that was, I don't want a colony of badgers. We would never come out alive. They are ferocious animals, and I think that would be incredibly difficult to have and study. So, but it is an area that I think more work needs to be done. They are truly, I fear them more than I would fear a cobra in a cage, to be honest with you. They're really ferocious. So not easy to work with by any means, especially in captivity. But yeah, another thing to look at. And I'm sure that if we could get enough plasma samples from those animals, we would probably find some anti-metalloproteinases and proteases and other things that we might be able to use to our benefit. That would be hard work.
It's fascinating that prairie dogs, they seem like an ideal prey item for a snake, but that they have that. I knew mongoose did, but I didn't know about the prairie dogs.
Yeah, they eat rattlesnakes. They're one of the prime predators for rattlesnakes in the prairies.
Fascinating.
Pretty amazing.
Other questions for Dr. Tegzes? I could just abscond with him for hours here because this has been a fabulous lecture, John. Just really, really
Yeah.
and very, very germane. I mean, we've seen one. We had a lady come into a clinic that we work out in the Serengeti called Ndulan. It's a very primitive hospital. And one year, a lady had come in and she'd been sprayed by a cobra about a week before she came in. So it was sort of the cat was already out of the bag, so to speak. But and she had some loss of vision in her eye. It managed to hit one eye, but she was alive. So, but that was just sort of, it's not every day that you have a clinic where somebody comes in and goes, "Oh, I was sprayed by a cobra." So,
Yeah, it's horrifying, isn't it?
yeah.
When we were in South Africa in the local, we were really in the bush. We were very remote, and we had some local people say to us and bring children to us, and that we noticed a little pattern right there that the forest cobras in that part of South Africa will eat fish, so that somehow they're attracted to that. And the people there also eat a lot of seafood. It was very close to the coast, and that the oral hygiene isn't the best. They don't necessarily even own a toothbrush. And they noticed a pattern that children, and particularly in the middle of the night, were getting envenomated around their mouths. And we wondered if there was some attraction to the scent or something of seafood, and that the snakes were noticing it. But yeah, cobras are, again, not only can they bite, they can also spray, and getting venom in your eyes can result in blindness. It's terrible.
Yeah, it's just we have a lot of the safari guides that we have had experiences with black mambas, curling up next to them, seeking out the warmth, and it's just there's that innate sort of makes you just send shivers up your spines. Hence the film, Flying with Snakes, or it's just but it's a fascinating. They're very fascinating creatures, and I think there's so much information that we could glean from understanding how their venom works and the physiology of snakes, and what where they sort of fit in the whole arc of biology here. So just a terrific talk, John. I'm just so delighted that we've had a chance to have you here, and very germane. I would request sometime if you'd like to do this for our house staff at Huntington, because we do see quite a bit of snake envenomation. Usually there's a positive correlation between rattlesnake bites and a high serum alcohol level.
Yeah. I mean, this goes so many years, and I hesitate to say it because it's politically incorrect, but do you know the 5 T's of rattlesnake envenomation? Have you ever heard these before?
Maybe, but
okay, it's really off color. So but there was a paper I found just today that showed that the demographics are true. So the demographics tend to be, the first T is testosterone, more men than women. They tend to be in their 20s or teens. They tend to be young. They're usually bitten on their hands. So that one of the T's is, I forget, tips of fingers or something like that. But tequila is usually a common denominator. So again, they tend to get to, it's one of those dare testosterone things. There's a snake, I'm going to pick it up. And tattoos tend to be associated, but again, that's like loose. It's an old thing that they used to say in poison centers, that the demographics. So I just read a paper today in preparation for the talk, and there was some study in a medical journal that looked at the demographics of snakebite, and they said, yeah, it tends to be younger men inebriated. I think those are the 3 common things, because they lose their inhibition to it. The worst, I worked in a poison center for a while, and the very worst rattlesnake envenomation case in a human that I ever was involved in was an elderly man who had a pet rattlesnake, and on a dare, while he was drunk, said that he told everybody, oh, his rattlesnake was his pet, he would never bite him. So on a dare, he took the snake and put it down the back of his shirt, and he got envenomated mid-back at heart level. And he was in the ICU for, I think, 2 or 3 months, and had gotten over 300 vials of antivenom because he had been so centrally envenomated. But again, there's the drunkenness thing. People will lose their inhibition and try doing bad things with snakes.
Yeah, and the truth is the snakes themselves are very shy. I mean, that's sort of, if you shuffle your feet and you move, they want to get away from you. They really don't want to envenomate people. But it's, there's some yeah, I've had a couple of really wild stories of, and how did you get bitten in your mouth?
Exactly. Exactly.
So,
Exactly. I know.
but they are a good and a very important part of our ecosystem. So I think that we need to protect them as much as we can as well. So
Agreed. Agreed. They're so important. Yeah.
I'd like to thank Dr. Tegzes again for enlightening us. It was just a fascinating lecture. And next month we have Dr. Aaron Berkowitz. You might want to attend this, John. Very interesting. He's a neurologist up at Stanford. Has written a wonderful book called One by One by One. He worked a lot with Paul Farmer in Haiti, and is very invested in working with underserved people in countries that really are kind of wobbly, as certainly Haiti is. So, so we're just really excited about kind of our upcoming speakers and events, and I'm looking forward to working a little bit with Dr. Tegzes. He's going to hear about our poop project on the Serengeti, and we're hoping to, I think Dr. Mattioli's on here, one of our other faculty members. We'd really like to start a relationship with the Western vet students and Huntington Hospital's medicine residents, because I think this is a great opportunity to get young people involved in One Health and eco projects. So,
well, we would love that opportunity. So I can't wait to talk more. And thank you, everyone, for your attention. I know it's probably been a long day for many of you, so I appreciate you coming out tonight.
Terrific. Don't dream about snakes tonight. Freud had a few things to say about that. So, all right, everybody. Well,